Hi, good morning. My name's Simi Ma. I'm a postdoc fellow at Cleveland Clinic. I feel honored to be grounded to travel to Santa Clara, California during early September this year, and it was my pleasure to attend the great course of the Advances in Pediatric Retina by the Jack McGovern Coast Disease Foundation. So I have been a COAST patient since 7 years old. I have a stage 3B COAST with macular involvement at the onset. So I underwent intensive therapy by laser during the range of 2 years, and while living with COAST for my ongoing life, I have pursued a career of clinical practice as well as scientific research. So it was of great value, in particular during the specific session for COAST disease, and unlike reading about COAST and literature, the reading materials, and even as a COAST patient myself, still it has been a tremendous shock to learn about COAST in such a systematic way, in a concise, plain, but scientific language by the collection of all the top specialists from the field of pediatric retinopathy and COAST disease from all over the world. Earlier this year, I have proposed a research project on COAST in molecular biology and genetics, which has been known by all. As you know, COAST is idiopathic, has unknown etiology, has little known molecular biology or genetics. So with the minimally available molecular research on COAST disease up to date, as well as multiple obstacles such as the small numbers of patients as a rare disease, lack of animal models, and limited access to fresh globe tissues, and so forth. So by learning some of the most recent research progress during the conference, including the further identification of an NDP-coded protein, which is called Norrin, which played a role in Norris disease, and which is also a COAST-like disorder, and the nuclear translocation of Norrin for a Wnt-dependent or an independent pathway, and also they talk about the role of FDD4 activation during the retinal blood-brain barrier function and restoration, for example. So all of their brilliant most recent updates warrants the continuation of the ongoing genetic sequencing research and my proposed in situ RNA-seq transcriptomic studies. So I will continue working with Jack McGovern COAST Foundation and get involved in the COAST research with my best scientific expertise and help COAST patients. So again, the attendance to the APR course was very, very beneficial and inspiring. And it was my pleasure to meet with Mr. Jack McGovern, meet with the members from the leading board of the Scientific Advisory Committee, meet with Dr. Hartnett, Dr. Maroon, and thank you so much. Thank you for this great opportunity.